Hi, good evening, everyone. I hope everyone is doing really well. My name is Hina Javed, and I am the Respite Mentorship and Volunteer Coordinator for Smile. I've been with Smile for just a little over 6 years now, and I absolutely love, volunteering and giving my time back to Smile. I grew a great fondness because I do it for the children and the families that are registered with us. And I absolutely admire the work that Smile has done in the last 10 plus years within our community and our diverse environment. Um, I have done many roles within Smile. I started off with just by simply volunteering my time at various events that we had prior to COVID times. Um, and we have been doing many events physically as well as online virtual programming. So ever since COVID started, everything has really just moved on to, virtual programming. But I've been volunteering with Smile for a long time. I've done roles such as youth Smile team leads, as well as heading various different projects for Smile. I've moved on to a little bit of more leadership roles just in this capacity that I'm in right now, which is the Volunteer Respite Mentorship Coordinator. I've organized RecFest events, annual galas for Smile. And ever since really COVID has started this year, I have done and headed Eid toy drives twice so far for almost 250 families that are part of Smile. We have been doing weekly food drives, and we've partnered up with a lot of local nonprofit organizations as well to provide for the families in need. Ongoing that's happening right now is something that I'll touch into a little bit later, but we're currently doing our tech drives, which is providing laptops and tablets to the children in need that are being homeschooled these days. And so we've been working on a lot of that. I wanted to take this time and welcome our Kaleidoscope team here. And I will we have Rumaisa Khan here, Heba Ahmed, and Noza. So I'll let you guys take a turn one by one and introduce yourselves and tell us about a little bit of your background and your experience within Kaleidoscope.
Thank you, Hina, and thank you, Smile Canada, for having us today. I'm Noza Hasleen. I received my Honours Bachelor of Science from the University of Toronto. And at the time, I was actually working with women and children fleeing violence at Woodgreen Community Services Homeward Bound program. And after I received my undergraduate degree, I worked as a case manager for individuals who have a developmental disability and also have mental health challenges. At the time, that was also at Woodgreen Community Services, and I was also working as a mental health counselor there. So it was really in this capacity that I started to notice and really observe kind of intimately some of the impacts that and barriers that happen in the system, and how those barriers and those impacts have really a hard and large effect on health and well-being. And over the years, this really led me back to my passion, which is health and well-being. And I decided then to complete my Master of Public Health at the University of Toronto with a specialization in health promotion and public health policy. Currently, I work at Dallana School of Public Health at the University of Toronto as a research analyst. And my research there involves so I lead and manage research activities exploring diabetes and migration and the social determinants of health, which we'll talk a bit more about, in South Asian communities in the Greater Toronto Area. And I'm also a founding member and consultant at Kaleidoscope Consulting.
Amazing, thank you. Heba, do you want to go next?
So hi everyone, my name's Heba Ahmed. I received my Master of Public Health from the University of Toronto's Dallana School of Public Health. This is actually where Noza and Rumaisa and I met. So I specialize in health promotion and public health policy. I'm also one of the founding members and consultants of Kaleidoscope Consulting. Currently, I'm employed at Holland Blairview Kids Rehabilitation Hospital as part of a research team that conducts research and knowledge translation activities related to the social inclusion of children and youth with disabilities at school, work, and in the community. I've previously worked at other research and teaching hospitals in the GTA and have done research with other demographics, including youth with mental health challenges and adults with episodic disabilities.
Thank you. That's awesome. Ramisa.
Hi everyone, so my name is Ramaisa. I'm also a founding member of Kaleidoscope with Noza and Heba. And so like Heba mentioned, we all met at the University of Toronto where I did my master's in public health. And so after completing my MPH, I've occupied a couple of roles in public health within healthcare. So most recently in evaluating digital health during the COVID-19 pandemic, and advising a more equitable perspective for COVID-19 assessment centers and Wave 2 planning. And then most recently in the women's cancer space in terms of spreading and scaling innovative models of care within treatment, prevention, and survivorship. But I think within this role in Kaleidoscope, I really bring the lens that I appreciate working with community, really strengthening community organizations, really working and amplifying our own personal lived experiences as women of color and racialized women.
That's amazing. Thank you guys. That's, that really gave me an insight into what each of you guys have been doing. So thank you for this introduction. I know you all mentioned that, of course, you guys are consultants with Kaleidoscope. And I just wanted to touch on that and ask, what is really Kaleidoscope and what is the vision of this organization that you guys have founded and have been a part of?
Sure, I think each of us will speak to that a little bit. So like Heba and Ramisa mentioned, we all met during our Masters of Public Health. And while pursuing a degree, we noticed that there was a gap in understanding, knowledge, and also perception of what, how, and why the determinants of health were affecting our communities. And research programs, policies are often done on our communities as opposed to with our communities. And there's a big difference in that. So the outcomes usually of those programs that are done on communities instead of with communities are don't often account for cultural or religious factors. And after we completed our Master of Public Health, we all found ourselves working in technical positions or some positions that didn't necessarily align with our true interest of being involved in community work. So we all started kind of separately and individually looking for ways in how we can get back and how we can use our public health expertise and apply it to areas that have more of like a meaningful impact in the communities that we grew up in, but also the communities that we're tied to. And so Kaleidoscope was born out of our shared vision to really give back to our communities.
That's awesome.
Heba, do you want to continue?
Yeah, so at Kaleidoscope, we believe that to achieve health equity, the whole needs to be considered. And this includes creating safe and cultural resources and religious spaces as well. So we also place an emphasis on the social determinants of health, as Noza mentioned earlier, which is really thinking about systemic and structural factors, such as access to employment, access to education, accounting for historical trauma, or even just current and political context and how that impacts people's lives.
Awesome.
Yeah, and just to add, I think one thing that one of our visions was that we wanted to be able to contribute to organizations that we cared about, but we didn't want to do it in a way where we were coming in and starting from scratch. And so for us, our vision was to kind of come in and bring in our expertise in health communication, knowledge translation, policy evaluation, and amplify the efforts of organizations that were already doing amazing work like Smile. So we didn't really want to come in and start from scratch, but amplify all that momentum that was already there and really focus on capacity strengthening. So that's something we're really hoping to do within our consulting work.
That's awesome. Thank you. And you know what I absolutely did love about you guys was kind of like a fresh pair of eyes that were coming in and giving us insightful information too, which, with the busiest situations that we've gone into because of COVID, we weren't able to provide it to our families. So that's where we really appreciated your hard work, where you guys stepped in and helped us out. So which leads me to tell everyone about the program. So earlier this year in August, Smile launched a virtual respite mentorship program for the kids and youth of Smile. And what it was, or really rather is an exclusive one-on-one buddy program that really builds upon creating lifelong friendships and mentorships on a more emotional, educational and more of a resources and resourceful respite need basis for our registered families. This program, recruits and vets, first of all, members of our community that are properly, thoroughly checked upon, from having their police background checks and then having to go through various sorts of therapy, mentorship from professionals from the industry, such as psychotherapy, behavior therapists, as well as some of our speech language pathologists have created webinars and, video modules for our mentors to kind of get qualified through and then move on to the mentorship program, which is getting paired essentially with one-on-one with the families that are in need and have individually signed up to be a part of this program. And that's really what this whole thing really is. During COVID, it's all virtual for now, and we've been providing toolkits to individual families based on their immediate needs for their youth or children. And basically, it's not only just a time to provide any respite mentorship, but also just some quality time spending with somebody outside of their immediate household member. And basically, that's how it really worked in a nutshell. And our goal really is to prolong this, inshallah, hopefully after COVID ends and we are able to interact a little bit more in person. So these friendships that are being created online can be taken forward, for a lifetime, essentially. And I know for this particular program, you guys at Kaleidoscope have created an advocacy tip sheet. You guys have created a caregiver's guide, and maybe you guys can touch upon a little bit on what your goals really was behind those tip sheets, as well as the caregiver guides that you guys had created for us. And you can tell our audience a little bit about those particular items.
For sure. I mean, firstly, I think that the virtual mentorship program is amazing with Smile, and it seems like it's been really successful and was a really great idea. And so for us in general, even aside from Smile, when COVID came, there was a lot of uncertainty with organizations, and there was a really quick ramp up to be able to serve a clientele and to address like these new needs that were coming up with the pandemic. And so we really,
and all of us were kind of in the same boat, right? Like we didn't know how to grasp and how to go about it.
Exactly. And so I think especially with communities that we're from, we really wanted to be able to bridge that information that was important in a way that was accessible and available for people to understand easily. So whether it was culturally appropriate or in simple terms or in a way that was digestible, and also kind of filtering through sources that were reliable as opposed to sources that weren't as reliable. And so the Caregiver Guide was a tool that we actually created. It was created by Zara Saab, who's one of our associates and founding members as well of Kaleidoscope. And it was kind of a resource for caregivers to kind of understand what sources were available out there for their own support, to understand how to reduce their own exposure to COVID, also kind of how to navigate the healthcare system right now when it's a little bit tricky, how to stay safe and stay well. And so that was one of the resources that we created for Smile. And I think Heba can talk a little bit more about the advocacy tip sheet.
Yeah. So the advocacy tip sheets were actually presented in an infographic format. So our main goal for this was to give practical and easy to follow tips that were presented in a creative way, but also easy to digest. So the infographics are actually something that are really common when it comes to presenting key findings in research to like stakeholders or other partners and clients and in the work we do in research. So we thought it would be a fun and different way to present the tips.
Yeah, and during the process, we were all able to provide input from each of our lived and professional experiences, which was really great to both create the guide, but also the infographics to make sure that they had cultural relevance and representations, both in the context of the content of the products, but also in the images. We also really tried to account for time and emotional restraints that comes with being a caregiver. So we really do hope that Smile families have been able to benefit from these and are able to benefit from the future ones that are coming in the next few months.
Exactly. Honestly, I could tell you right off the hand because I speak to the families personally myself, and I wouldn't say hand deliver, but we had mailed them out physically to all the families that are part of us. And I got a lot of great feedback because they actually found it so helpful because they were just getting information overload from the internet. And guide really did provide them in a very nicely put together nutshell about the resources that are available. And like you said, the reliable resources, as we know, the internet is just full of things that are, some of it is untrue and some of it is, not really reliable piece of information or the right links. So I really did want to thank you guys for not just creating that caregiver guide, but also the advocacy tip sheet. And I know you guys did that from a self-advocacy perspective as well as a caregiver perspective. So a lot of our youth really enjoyed that actually for themselves, because they're starting to vocalize themselves now, and they're trying to, talk about it amongst their family and friends. So they were able to touch on that from those tip sheets. So it was really, really good. And I thank you guys for all that hard work that, we were going back and forth about those for a while. So it was really awesome. And I'm really, really looking forward to creating some of the future pieces for our families and our audience of Smile. Just to kind of wind down a little bit and not take too much the time of our audience, as I know it's much later in the evening. Some of our members of our community might be just tuning in right now, as we're in the middle of, right in the middle of the second wave, and also with the vaccine news that has been, coming in, and a heavier winter will kind of kickstart in 2021. If you do have any advice for the parents, for the caregivers, or for the children and youth coping on how to really cope with the next few months, let's say, just, some simple guidelines or tips that you can provide to some of our audience right now, that would be really, really great and helpful.
Yeah, so our day-to-day lives were like never simple, and obviously with COVID, it's definitely added an accelerator to that. So in terms of advice, we collectively would advise that families follow the current public health guidelines. So this would be like, following gathering restrictions, shopping guidelines, quarantine measures, and so on. And also just using the information and resources that supports like Smile provide to them. So while we're almost a year in, like these are not normal circumstances, and we can't hold on to our like normal expectation of trying to figure everything out. So we need to manage our expectations for ourselves, but also for our families. So this is not a time to worry about being as productive as possible, but instead we should be focusing on our own emotional and psychological well-being. We would also encourage everyone to be creative in how they utilize their village. So for example, having pre-scheduled virtual calls or play dates with friends and family can really help themselves and even their children deal with these uncertain times.
Yeah, as a mother of 2 children myself, and 2 young children, I really can empathize with how difficult the winter is going to be with very limited indoor facilities. I'd love to say bundle them up and take them out, but I know that this is not always a possibility or a reality. So for both the caregiver and for children, I'd say try to squeeze small things that you enjoy into your day that will keep you going, things that give you energy. But I'm going to draw from my experience in mindfulness to do this. So one way that you can actually do this is to think of your typical day. Think of a typical day, and it could be a weekday or a weekend. You can start with either, and write out all your activities that happen in that day from the time that you wake up to the time that you go to sleep. So I'm saying the time that you wake up, meaning start with the sound of your alarm, if that's what you wake up to, and then what you do following that. And after you've listed all of these activities, label them as either nourishing or depleting. Nourishing activities are ones that lift your mood, give you energy, or help you feel calm and centered. Whereas depleting activities are ones that lower your mood, they exhaust you, or make you feel really tense and stressed out. And once you've done kind of labeling all your different activities, you really kind of have to do a little bit of reflection and in trying to bring balance back into your day. And how you do that is you can look at something as depleting, you try changing something about it. So maybe it could become nourishing if you're doing the activity with somebody else. It could become nourishing if you change the time of day that you're doing it. I'm going to suggest that you try to space out your nourishing and depleting activities, so your depleting activities aren't in one chunk. And sometimes this is not possible, but if that's the case, then I I'd suggest that you sandwich depleting activity between two nourishing ones. So if you have a depleting activity, stick a nourishing activity before it and stick a nourishing activity after it. If you're able to do this with your child too, it's something that I found helpful. And it's also something that a lot of people that I've done trainings with have found helpful as well. Finally, I think COVID has really taught us that it's really, there's not a ton of merit in living in the future because the future is uncertain. And I think one take home for me has been the importance of the present and the importance of today.
That's actually like, I don't even have kids and I can relate to it on so many other levels, just from a day-to-day perspective, because for somebody like me who works from home right now and fully inside, my four walls, it can be a little bit overwhelming. And, then you can fall into the trap of doing a number of depleting activities.
Absolutely.
Versus finding, maybe even one or two nourishing ones. So, and then I liked the method of you suggesting having a nourishing activity and then maybe a depleting one and then ending it off again with a nourishing one, because you kind of have something to look forward to.
Absolutely.
As well, right? So,
absolutely.
And that changes your perspective and mindset into a more positive side. I really believe.
Absolutely. And I think more than anything, it brings awareness to your day as well, right? Like, and sometimes I've had a lot of people, like I've done this, I'm a certified mindful stress reduction through mindfulness trainer. So I've done quite a few trainings, and this activity is always like a top activity that everyone comes back and says, this has really helped change my perspective. This has helped awareness, my own awareness. So I think just being aware of what's depleting and what's nourishing is also helpful.
No, that's awesome. I really like that actually. And I think a lot of our audience who would watch this, it will really help them, because I know a lot of mothers are dealing with that, like you said. And that's one thing synonymously I've been hearing from various mothers, that it's very draining to go through something like this. And then they have zero energy. But if they get like a pattern of some sort and like a guideline for themselves,
absolutely,
it will definitely help. And like you said, mindfulness is very important, I think. So that's great.
Yeah,
do you have anything to add?
Yeah, first of all, that nourishing depleting activity, Noza has always been telling us about it, and I think it's amazing and phenomenal. One thing that I would add is that a couple of things is that I think nourishing activities can be something so small. Like, I think we get joy from small things now. So I think that you don't even have to think of nourishing as something like going out and working out or doing something so extreme. It could literally be in the everyday, like cooking or just being mindful in the moment.
Absolutely.
One thing I would also say, I think, is that as much as these like suggestions are so great in terms of, keeping a routine and balancing our activities, I think self-kindness is also so important right now, because I'm sure that there will be days where perhaps you're not able to keep a routine, or you won't be able to understand what your balance was with being depleted or being nourished. And so I think that it's important to really be kind with yourself and understand your feelings, sit with them, acknowledge them. One tip that I found really helpful actually was that don't focus your day on how productive you are, but rather how present you are in the moment. And so I think that's been a tip that's been helpful for me, and I'm sure will be helpful to caregivers and families as well.
Awesome. I actually just have one question from the audience that did pop up. And I'll just say it to you guys here, and then whoever would like to answer it could. How do you recommend families navigate their children's time at home during the harsh winter? So not their own time, but for their children. And dividing
I mean, none of us are really experts, like none of us are educators. So again, it depends on how old the child is. But I think as a mother, I can speak to that, in that it's one thing that has worked for me is trying to be as consistent as possible. And children, depending on the age, they might not be aware of time, and that's fine, but consistent with activities. That's always helpful for children, because children are looking for and they expect consistency. When there isn't that consistency, it throws them off balance, it throws us off balance. So that's something that I would suggest. I know this is not always easy to do. And again, I'm stressing that it's not consistency in timing, but just kind of order of activities. And again, you can modify that and stretch that depending on the child's age.
And honestly, I think the consistency aspect is really helping to create like a habit even, you know?
100%. Yeah.
Right?
Yeah.
So the habit will get them to not only stay consistent, but create
Yeah.
positive environment and factors.
Yeah. Yeah. And they know what to expect, right? It's it's one less argument of getting them to do something.
And then
Yeah.
so when you're consistent, they just know that this is what it's supposed to be like.
Yeah.
And they're
Yeah.
seeing day in, day out. So it just becomes a
Yeah.
habit then.
Yeah. But I think, and also to acknowledge that as adults, we've felt burnt out. This pandemic has brought all sorts of uncertainty for all of us. Children are navigating this without that entire knowledge, without that entire understanding. No matter how much we've explained kind of the pandemic, the circumstances, it is difficult for children to digest this information. So really kind of bringing that into our consciousness and remembering that it hasn't been easy on them. They've been stripped of like many individuals in their community. They're not able to interact as children normally would. Masks,
which is, I think, the hardest thing for the
absolutely,
children, right?
Absolutely. Playgrounds, indoor facilities, in face-to-face recreational programming, all of that. Like I think in the summer, to an extent, we were still able to continue that outdoors. Like recreational programming still kind of was able to be sustained outside, but I don't see that happening. Indoor playgrounds are all closed. So those things are pretty big ones for kids, and that's how they thrive in the winter months, right? So just bringing that to our consciousness and remembering that is important as well.
Yeah, definitely. Thank you. And just having that faith, right? Like we'll get through it collectively.
For sure.
We're all dealing with our own little tiny struggles in our own ways, but in the grand scheme of things, we're all in one boat technically.
Absolutely. Absolutely.
Well, thank you so much, guys. We really, really did appreciate this. And I thank all our audience who joined in today to watch and hopefully learn a little bit more about what Smile has been doing and what Kaleidoscope is all about. So I want to just take this last moment and thank each and every one of you guys, Rumaisa, Heba, and Noza, for joining us and hoping to, continually work together and getting through COVID, inshallah. And thank you everyone for tuning in, and inshallah we'll see you guys another evening. Have a great day.
Thank you for having us.
Thank you for having us.
Thank you.
Bye.